Hi everyone, I'm Dr. Martin Huang. I'm a sorry.
Hey guys, so right now we are at MH Plastic Surgery and I'm here with Dr. Martin Huang, and I have been wanting to do my double eyelid stitching for a while now, so I'm sure you guys would want to know more about the surgery and like what is the procedure and the frequently asked questions. So thank you so much for being here.
Hi Nicole.
Hello.
Nice to meet you.
Nice to meet you. Okay, I'm just gonna ask you my main concerns.
Okay.
Because I think a lot of people before like surgery, they will ask, is it painful?
Yeah, okay, sure, you're right. I mean, it's always a question that is on the mind of every patient. So the key to not having pain is to have anesthesia, right?
Yeah.
Basically, there's two choices. We can do the procedure under local anesthesia, which means we inject local anesthetic into the eyelid tissues, and the anesthetic drugs will numb the tissues so that you literally don't feel any sensation. Then when we do the procedure, you don't feel any pain at all.
So if you have to inject my eyelid, do you have to like flip it up?
Okay, yeah. So I can see you've done some reading. So yes, you are right. So basically, we need to inject the outer aspect of your upper eyelid as well as the inner surface. So yes, in order to get to the inner surface, we have to flip your eyelid inside out. Now, the flipping of the eyelid is not painful, you know. You can flip your own eyelid inside out.
I know,
and
but
it's
do
not
your
gonna hurt.
patients say that it's painful when you inject?
Okay, yes, the injection itself is what causes the pain. I mean, you know, when the needle is going through your skin or the inner aspect, the internal surface of your upper eyelid, then of course that will feel pain, because we've all had injections before in our lives, right?
But how many injections do I need?
Yeah, so typically for the external aspect, we would need 2 or 3. Now the reason why it can't be just like one single injection is because we use a really small needle, and of course the small needle is less painful, so it's worth it. It's worth having a few extra shots with that very small needle because it doesn't sting so much, you see.
So do your other patients say that it's a bearable like injection?
Actually, the honest answer is yes. So I think a fair way to describe it would be it's unpleasant but bearable.
Okay.
Of course, you know, everyone has a different pain threshold, right? And we've had patients with very high pain thresholds who hardly react, you know. It's quite amazing actually, because I think I would react a little bit myself. And to be fair, there are some patients at the other end of the spectrum who have pretty low pain thresholds, so they may react a little bit more. But you know, if we talk about an overall basis and looking at a large number of patients or people who go through it, I think it's fair to say that the majority find it a bit unpleasant but bearable.
So how long will I take to recover?
10 days is about the guideline that we'll give you. For the first 10 days, because you need to apply antibiotic ointment on the wounds on your upper eyelid, there are still wounds, you know, because the needle will still create puncture wounds, right? And you want those to heal really well. So first 10 days, you need to apply antibiotic on those wounds to make sure they heal well, so no makeup allowed. But after 10 days, you can start using eye makeup.
So I've heard that double eyelid stitching has like a lot of failed cases because it either fades away or, you know, it's not the same height.
As a general rule, the simpler the technique, the faster the recovery, but the higher the chance of failure. The more complex and, shall we say, aggressive the technique is, perhaps the longer the recovery, but then the lower the chance of failure. And that's why I prefer that kind of technique, because at the end of the day, what we really want is good long-term results.
So I saw online that some doctors say they can finish this procedure in like 15 minutes. Okay, this is just like a question. Can you finish the procedure in like less than 10 minutes?
I could if I use a greatly simplified technique.
Talent.
I could, yeah.
Talent.
But I wouldn't, no, but but I'm not really saying this as a positive thing because, but why would I do that?
Yeah, true.
And why would a patient want me to do that?
Yeah,
because
definitely.
a quick, simple technique is going to have a high risk of failure. Yeah, and you know, if you have a failure, then all you're going to end up with is regret.
So thank you so much guys for watching this video. I really hope that you guys also have your questions answered, because I'm sure some of you are really interested in double eyelid stitching as well. So I hope that we cleared your doubts. So thank you. Have you done your eyelids?
No, mine were done by God.
Oh my god, something he did not give me.
Life's unfair.